Assalamualaikum warahmatullahi wabarakatuh. My name is Monica Desmarita from regular to a pharmacy study program student ID number 0512010056. Here I will present about the profile of non-steroid anti-inflammation drug used in Indonesia. 1. Distribution of the mechanism of action of drugs for indication of inflammation and pain. The distribution non-steroid anti-inflammation drugs is based on their classification and first based on a doctor prescription is so in fixed non-steroid anti-inflammation with a COX-2 selective mechanism versus the doctor where Nancy 6.6%. Well, those with particular selective, non-selective, or prostaglandin inhibitor mechanisms were mostly purchased without a doctor prescription. Non-steroid anti-inflammation drugs used to create various indication inflammation, access, and rheumatic were mostly drugs that work with non-selective mechanisms as much as 73.8%. This type of drug is widely used because its provides a fast effect, is pain relief, is an easy to get. In this study, the selective COX-2 form was selected, while the selective partial form was meloxicam. The selective partial class of non-steroid anti-inflammation drug meloxicam was a risk minimum to gastrointestinal and cardiovascular, so it is the safe when compared non-selective non-steroid anti-inflammation drugs. Meloxicam is selective to COX-2, but a dosage of 7.5 milligrams is still causes gastric use when compared with piroxicam or slow-release sodium diclofenac, so that it has a low irritation effect on the stomach. The results of the analysis show that most the anti-inflammation drugs used to create complaint of pain, action, and rheumatic are non-selective because the drugs are adorable and compared to COX-2 selective ones. However, it is advisable to use non-selective drugs for a long time. Selective for COX-2 is adult and avoid serious side effects harmful. Mefenamic acid is also included in non-steroid anti-inflammation drugs that work inhibit prostaglandin. The use of non-selective anti-inflammation and prostaglandin inhibitors in weight forces by the public without use of doctor prescription source of anti-inflammation drugs. Most there are available from pharmacy 38.3%, from healthy work 23.6%, and from formal health service 22.1%. However, there are still many people who get non-steroid anti-inflammation drugs from drugstore and food stalls. 2. Duration of non-steroid anti-inflammation use. The results of the analysis were to the complicated to self-medication without a doctor prescription and for a long time, more than a month. Conversely, to overcome an acute rheumatic pain they suffer. There was also the use of more than one non-steroid anti-inflammation drug in other combination therapies to treat chronic disease. The period of use non-steroid anti-inflammation in Indonesia still good, with mostly between 1 to 3 days, but is used for non-rheumatic preferred joint disease increase with age. The prevalence of joint disease diagnosed by health personnel or who have symptomatic choices in higher the at the age above 75 years, with 33% and 54.8%. The prevalence is higher among women than men, and respondents to do not attend school that does how attend school. Higher prevalence in people with economic level low resides on the lowest ownership index of 15.4%, so that the need to use non-steroid anti-inflammation drugs to treat this disease is also increased. The types of non-steroids that are researched in a doctor and healthcare service are non-selective non-steroid anti-inflammation drugs. For example, diclofenac, metamizole, piroxicam, paracetamol, acetosal, indomethacin, phenibutazine. 3. Indication for the use of non-steroid anti-inflammation drugs. Most indications for using non-steroid anti-inflammation are for complaints of pain, rheumatic action, 65.17%, general host member self-medication is treat pain. This non-steroid anti-inflammation drug is consumed for indication of pain that accompanies various complaints such as flu, cough, and others. The drug is also used for treat asthma, wheezing, and shortness of breath. Although the percentage is only set at 0.3%. The use for this indication is not upward and includes irritational treatment. Some for the extent complaint include irritation, use of non-steroid anti-inflammation for treatment, such as cold, influenza, cold, and use of non-steroid anti-inflammation drugs occurs because of self-medication by communicants as seen from the results of the analysis. Physics of data from recorded 20 and 13 non-steroid anti-inflammation drugs are widely used in the prevalence of joint disease from the diagnosis for healthy folk are 11.9% and 24.7%. Based on diagnosis or symptoms, people who buy the owner medicine from drug stores and self-medication to deal with pain complaints report in as much 26.4%. Most non-steroid anti-inflammation drugs in hospitals and obtained from pharmacies for rheumatic pain and non-rheumatic pain. It seems that there is still a need for regulation related to the sale of drugs to public exteriority to the purpose of self-medication. Thank you and stay healthy. Wassalamualaikum warahmatullahi wabarakatuh.